Thank you. You may have been expecting one of my team, Claire Blaine. If you signed up for this event, you'd have seen her name on the original agenda. You've got two for the price of one, so I don't want you feeling like you're ripped off. Claire couldn't make it at the last minute, so Rich and I have stepped in, hence I've got a few extra cards to help me. So welcome. I guess the slide here sets the scene, but I just want to do a little bit more context setting. So we're going to explore today the increase in interventions, health and wellbeing interventions post-COVID, the effectiveness of increasing those employee interventions, and whether more is better, and addressing issues affecting the workplace at all levels of the organisation, not just the front line, particularly looking at burnout and middle management. So a little bit more context. We know that the cost of ill health from our Britain's Healthiest Workplace survey that we run has been increasing massively. And medical inflation, for those of you that I think probably most of you have private medical insurance schemes, medical inflation is also accelerating at an alarming rate at the moment. So what's in it for employers in terms of investing in health and wellbeing? So we know that there are 4 lifestyle behaviours that people make decisions on in their day-to-day lives that give rise to 60% of all the deaths and 80% of healthcare costs globally. And this isn't Vitality or Britain's Healthiest Workplace data, this is Alliance Healthcare data. And so if you can impact those 4 lifestyle behavioural choices and improve the decisions that people are making on a day-to-day basis, there's a lot to gain as an employer, as an individual, and for society. So those 4 lifestyle behaviour choices are smoking, drinking excessive alcohol, physical inactivity, and poor nutrition. And as human beings, we know what we should be doing around most of those things, and yet we do them anyway. Why do we do that? It's called hyperbolic discounting, and it's because some of the things that we're choosing to do now are going to affect us a long time in the future, right? So we don't make those choices now because it's in the future. It's a bit like some people believe in climate change and are doing the right things now, and other people are like, oh, it's so long ago, so far away, it's not going to affect me, I'm not going to do anything about it. So some real read across to that. Okay, so through health and wellbeing, we can help people to improve those behaviours and reduce their healthcare costs and reduce the impact to your organisations. So we're going to look today at how do we engage people, what have we learned, and what's the benefit for both the employee and employer. So I've referenced Britain's Healthiest Workplace survey. The data that has collected across many different clients, will speak to the size of that survey as well, not just Vitality clients, speaks to the cost of absenteeism and presenteeism at being £127 billion. It cites 2.5 million costs due to people being out of work, due to ill health. And in that data, we've been able to measure that there is 50.6 days on average per person lost each year in terms of productivity to absenteeism and presenteeism. Rich, has that gone up? I'm assuming it has.
It has, yeah. So since 2019, we took a 2-year break. Something happened, 2020, 2021, something like that with Britain's Healthiest Workplace. But the data in 2019 was 38 days combined. Now that's shot to 50.6, which is no real surprise. I'm sure you agree.
So according to Britain's Healthiest Workplace, the number of interventions has gone up. Engagement for some organisations in some of their health and wellbeing interventions is still low. So how do employers drive engagement? And what do we see through the impact of the Vitality programme and some of the interventions that Vitality offer? And then we're going to finish with the impact on the line managers, as I've mentioned as well. Okay, so what does the evidence tell us from that survey about the number of health and wellbeing interventions?
So the scale of the survey, we've got data from about 580 organisations with over 2 million points of data,
Data
and
points,
about 185,000 employees data all included in this. So we saw that in 2022, 80% of employees had more than 40 interventions to support their health and well-being in the workplace, which is great because they've got more choice. But the question then is that better? Is more better for that? And what it's seen is we've shared the productivity number. Productivity has got worse. And the productivity score comes from lost working time from absence due to poor health or presenteeism due to poor health. Because we ask within the survey, how many hours per day over the last week have you lost to work because you couldn't concentrate on your job due to your health? So we're not talking about the boiler broke. We're not talking about homeschooling at that time. We're talking about, actually, I couldn't concentrate on my work because I wasn't well enough to do it, which directly influences that impact. So I suppose that's the scene set. There's more available to people, which is great. However, it's yet to have an impact from a data perspective.
And I guess there's more because through COVID, I think employers and organisations globally saw the need to invest in health and wellbeing, and maybe they've got more budget. Maybe they've been buying additional products and services.
And again, it could be a lack of data. So it could be, you're seeing things and reading things that's out there, but actually the true data of your own workforce may not have been available to you to be able to base that on. And obviously that's where, we'll talk about Britain's Healthiest Workplace as the largest in the UK to do that, of course, because that's the data set we're privy to. But having an idea of the health of your people is key to deciding what intervention that you make available to them.
Okay, so a lot more interventions. Million-dollar question, is more better?
Well, yeah, I think we've alluded to this. And what we ask in Britain's Healthiest Workplace is we ask the employer to complete an idea of how many interventions they have available for their employees. Then we ask the employee how many of those interventions they're aware of. So the company will say, well, we've got, on average 33 interventions, but the employees on average, certainly with small businesses, were only aware of 67% of those. And only 26% of those employees actually use those interventions, which means that that's a funnel and not enough's going in at the top. So the impact at the bottom is minimal. But I will caveat that is the impact at the end in those circles. But the employees that felt that when they participated in these interventions, they felt really strongly that they had a positive impact on their health and well-being. So we're not going to sit here and go, our solution is the only solution, but it's about going, but solutions work, but not enough people are finding them and using them. And that's the single hardest thing. And when I do my day-to-day job of talking to people about our programme, engagement's the hardest thing. You can have a great widget at the end, but how do you get people to your widget to get them to understand it? And that's really the toughest thing. And, hopefully you'd agree with me.
So before I move on, is there a magic number where you've got 33, 43, 48, gets bigger with size? Is there a magic number, Rich?
There doesn't seem to be. I think from our point of view, when we've looked at the winners of Britain's Healthiest Workplace in each sector, they weren't necessarily all the companies that had the most interventions in order to get the most impact from those. So, it doesn't seem to be a magic number. I'd be lying if they said there was.
No. Thank you. Okay, so what can employers do to improve engagement?
So, again, I'm not going to teach you to suck duck eggs because this is your day-to-day job. But what we see from the data and how we use the Vitality programme is a few approaches. The first approach is when things are talked about at board level, and this is research done by Professor Dame Carol Black, when health and wellbeing is discussed at board level and a minimum of a quarterly basis, it's shown to have an influence of about 20% increase on uptake of those services. Because all of a sudden, it's important at the top level of the company and that data is being shared. The next step along that is certainly with the Vitality programme. Those of you that know the Vitality programme, hopefully I'm going over old stuff, but we'll talk about it in a bit more detail. But it's a programme that rewards and incentivises people to take responsibility for their own health and hopefully makes it easy and exciting for them to do that. Rewards and incentives increase the likelihood of success by 70%, again, according to Britain's Healthiest Workplace data. So, and the great thing about that is when you take that 70 and that 20, you can add those two together to get 90% increased chance that that programme is going to be successful in your workplace. So that's one way. And on this side, we talk about the impact of this. So increased life expectancy is a great stat, of course it is, but actually what we're talking about is diminished risk. So we're saying we're lowering people's cardiac risk. We use Q risk as a calculator for that. So we're helping people to be healthier now, and that's key. And then underneath that is the impact of productivity, and we'll talk about that because that's quite emotive to go, well, we will make people more productive at work. So that's got to be music to many people's ears here, and people tend to report higher job satisfaction too.
Okay, and as I referred to at the beginning, if you can get more engagement to change people's lifestyle behaviours, you have the opportunity to lower the risk factors in your total workforce population, and therefore your medical costs as well as your productivity that we mentioned here. Thank you. Okay, so you've mentioned the Vitality Programme. Of course, I know all about it, but can you give us a quick overview of what the Vitality Programme is and why we're speaking to the data set that we are here today?
I will, very quickly. So Vitality Programme is currently the world's largest wellbeing programme. It's within insurances around the world because in the early 90s in South Africa, some gentlemen decided it was time to disrupt that market because they saw that health insurance and health weren't linked. So your health insurance did nothing to keep you healthy, it just helped you when you weren't. But actually, if there was a programme that rewarded and incentivised you to adopt healthy behaviours, it made sense to us as an insurer because you go, you know, we've got healthier people, so there's less chance they're going to claim for avoidable lifestyle diseases. So we can make their rewards and incentives more appealing because we're confident that they're earning those rewards through healthy behaviour. So they stay with us longer. So that's great from our perspective, but on a wider perspective, and certainly from a workplace perspective, your employees are like our members. So we want to make sure they're getting the most out of work. They can come to work and perform and be their best to be able to enjoy their work. And the way we do that is three ways. First stage is to enable them to understand their health. So we want them to go have an understanding of where they are from a health perspective. So we do a health review. Health review covers a number of things about their current health, smoking, mental health. We use the Kessler score, nutrition, that sort of stuff. And we give them their vitality age, which is their health age. So people are often a bit scared by this, and it helps with hyperbolic discounting because people go, wow, my vitality age is older than I am. I need to do something about this
it's
now.
That call to action.
Exactly, rather than waiting. Then we want to be able to lower the obstacles to them getting support. So we work with reward partners, many of the companies that you would recognise, the likes of Pure Gym, the likes of Garmin, all these companies we work with that are able to then offer these people access to those services at a rate they couldn't get, but we're able to record their behaviour to then reward them for doing that. And that's the last stage, to give them these nudges of rewards. It's based on Richard Thaler's nudge theory to go, do this for a week and you get rewarded. You'll feel better. Even before you get the physiological differences that we all want to get from exercise, you go, I got my reward, I got my free coffee, or I got my movie, and that sort of stuff. And it nudges people along and hopefully affects that self-efficacy, that situational self-confidence that we all want, that we go, feel a bit better today than I did yesterday, which is key as well.
Thank you, Rich. So how does Vitality in Britain's Healthiest Workplace measure the impact and the efficacy of some of these benefits?
That's an excellent question, Pippa. I have got an answer, I think. So we've talked about vitality age. So what we're able to do with vitality age is to understand people's vitality age gap. Now, the average age gap is about 4 years older than they actually are. But the impact of that from a productivity perspective is when we think about that absenteeism plus presenteeism data, that 50.6 days, is that every year that your vitality age gap improves. So if I had a vitality age gap of 3 years and I did a good bit of exercise and they went, Rich, I went back on and said, I've done 3 months worth of exercise, I'm going to go up again. And it said, Rich, you know what, it's down to 2 years. What that means is I have improved my productivity on that same formula by 5 days back to my employer.
Per year?
Per year. So that's why we can then go back and say, you want return on investment, here is return on investment on our programme as an intervention to support people to improve their productivity.
And does the Vitality Age algorithm and on what they go through there, does that flag to the employees what they can do?
Absolutely. So the employees will get a report of their next best action, of what they could do first to have the biggest effect on that. And then the employer will get access to anonymised and aggregated data to see trends in the workforce. And if they've segmented different areas, then they can look at that as well.
Okay, so understand the data so you can take measurable interventions and measure the effectiveness
Absolutely.
of those interventions, both at an employee and an employer level.
Absolutely right.
Thank you. Okay, so the importance of line managers. So we've talked about the programme, we've talked about the need to change behaviour, we've talked about the impact on productivity and absence. Why are we talking about line managers? What's the importance of their role here?
So line managers are your army. So they're your army on the floor to talk to people about all of these services you've got. What we've seen and what we've been surprised by from Britain's Healthiest Workplace data this year is that stat at the top, that's 78%. So employees feel, 78% of employees feel that their line manager cares about their health and well-being, which is amazing. Like, that's a great story. But when you go back to that first slide about awareness of the interventions that you've got for your people, there's got to be a disconnect there. So what are those line managers talking about to have that great score, to then not to be talking about the products and services and interventions that you've got available to them? And we think that could be partly down to them being squeezed and being that squeezed middle.
Yeah.
They're going, I'm doing my job and I've got to do all of these things as well. So how we do it in Vitality is we support line managers by giving them training in understanding their role and their responsibilities, and then we'll work with them as a group of people to come together on a regular basis and share best practice, share what they've done to try and drive these behaviours and help those colleagues that might be finding it a little bit harder to do these. Because that stat at the bottom, the burnout stat, again surprised us. The group of employees that were most affected by self-reported burnout was managers, with nearly a quarter of them reporting self-reporting burnout on Britain's Healthiest Workplace. So that says to me that there could be a bottleneck, because if they're not able to put their own oxygen masks on, how can they help somebody else? And I love Superman, I'm a massive fan. So my analogy is like when Lois Lane falls out of the plane in Superman 1 and Superman catches her and he says, okay, ma'am, I've got you. And she says, you've got me, but who's got you? Yeah. And I feel that way about line managers. Like, we expect them to look after everybody else, but we might not give them what they need to be Superman in that example.
And the world's been turned upside down for many people since COVID, and now obviously the cost of living crisis and everything that we're going through. So
absolutely.
We've got so much more to deal with now than ever they had before. There is no normal, no normal anymore. Okay. Do you think businesses are doing enough to support line managers? So you mentioned the training there. So should they be just sending people on lots more courses?
Yeah, for me, and again, looking at Professor Dame Carol Black's data, no, is the simple answer to that. Going on a day-long course doesn't change behaviour. That's why we exercise forever, because we want to lay down. So it's about creating a culture of sharing, mentoring, whatever the right thing is for you. I'm loath to say you've got to do this thing and that's your thing, but you'll know in your businesses what works well for you and what doesn't work well, and actually the group of people that you've got. So it's making sure that actually, do they understand their role? Do they understand what's expected of them? Do they understand the benefit of helping people with their health and well-being? Or are they just pushing to go, all right, you know what, I've been told to do this?
Okay, so measure the well-being of your workforce, the risk factors of your workforce. Identify what the solutions are. Don't just chuck loads of things at it and keep chucking more at it. Measure the efficacy, the usage, and indeed what that data is telling
Absolutely.
You. Okay.
And ask. I think line managers, they're a great result. Ask them what they need. They're not going to be backwards in coming forwards of being offered support.
Thank you. Okay, so we've talked about some Britain's Healthiest Workplace stats in here. We're now going to wrap up. We've got a stand if anyone wants to come and ask us. Rich knows loads more, and we've got loads of good data for you. And the Vitality programme that we've referenced here is embedded across all of our private medical insurance products, some of our life products as well, and is also available as a standalone programme for large uninsured populations. So I'm just now going to offer, we've got a little bit of time to open up for questions, if I may.